Chair. Senator Seidman.
Thank you both very much for your presentations. Mr. Calent, if I might begin with you. Dr. Calent, sorry. And in fact, you've just started to mention alcohol, and I'd like to ask you a bit about that. So we have heard that the rationale for this piece of legislation, C-45, is sort of based on an assumption that legalization will reduce the number of cannabis users. And most importantly, it would prevent access to marijuana by underage users. We've heard from supporters of legalization that alcohol control measures provide a good model for controlling youth access to cannabis after legalization. And could you speak to us a bit about this and the success or failure of alcohol control measures in managing teenage drinking? And do you have reason to believe that a similar regime for marijuana will be effective?
Thank you for that question. It's a very important one. I think the experience with alcohol shows quite clearly that regulation alone does not control level of use by youth. Under present conditions in Ontario, for example, surveys of Ontario secondary students have shown that under the present regime in which it is illegal to sell or purchase or distribute alcohol to those under 19, there nevertheless is even in the 12-year-olds about 10% who have used alcohol within the past year. By the time you reach 17-year-olds, there are about 20% who have been either drunk or had serious overuse within the past month. I think our experience with alcohol makes it perfectly clear that regulation alone is not the answer. Regulations can be ignored and have been ignored to a large extent. I think also the idea that cannabis is safer than alcohol, and therefore it doesn't make sense to have it illegal while alcohol is legal, is also a very tricky argument. Sure, alcohol is more dangerous than cannabis in some respects. For example, you can die of an overdose of alcohol, and you can't die of an overdose alone of cannabis. But if you die of a motor vehicle accident caused by an impaired driver with cannabis use, you're just as dead as if you died from an alcohol overdose. And we all have to recognize that the spectrum of harmful effects is different for alcohol and cannabis, so comparing them is not simple. I think it's important to disabuse people of the idea that cannabis is safe and that it should be legalized in order to be rational in relationship to alcohol. These are poor arguments and misleading and dangerous to society.
Okay.
So what you're saying is that the model of alcohol control measures doesn't really work as a model for cannabis. And what would you say about the fact that it's also said that legalization will reduce the number of cannabis users and prevent access to marijuana by underage users?
There is no evidence to support that at all. In fact, the evidence that we have from Colorado, Washington, and other areas that have made access extremely easy is quite the opposite. It increases use, total use. It increases the number of emergency room visits. Excuse me. It increases the number of hospitalizations for causes attributable to cannabis. It increases deviation to the black market. It's been shown that so-called even medical marijuana in Colorado, and now increasingly with non-medical legal cannabis in Colorado, the Colorado product appears in other states that have not legalized. In other words, a significant proportion is being deviated to the black market. So the argument that legalization will somehow reduce use simply does not make sense. It's opposite to everything we've ever learned about other drugs.
Dr. Barth, if you have anything to add to that?
The one point I did want to pick up on about the comparison between alcohol and cannabis, I agree with what Dr. Calant has said, and I think part of the reason why people have this perception that cannabis is safer than alcohol is because we simply haven't had prevention campaigns, public education campaigns. The public is simply not knowledgeable about the effects of cannabis use. The other piece is if you look at we've been studying alcohol and the effects of alcohol for decades, and we simply don't have the same evidence base that we have for cannabis. If we move forward with legalization, I'm hopeful that this will help to make it easier to conduct this health research to better understand what some of the health effects are, because it's currently very difficult and cumbersome to get through the various approvals to conduct this type of research.
Okay, thank you. Let me move